Right. So we are going to talk about how do you know when to go back to hospital after you've given birth? There are things we call red flags or danger signs, and these are some of the things that if you see and you have given birth, get help immediately at the hospital. One of them is bleeding. If the bleeding that comes with childbirth is very heavy, please go to the hospital. Bleeding, excessive bleeding after childbirth is one of the top killers, not just in Africa, but even in the world. So get help if you're bleeding too much. And one of the ways to know that you're bleeding too much is if you're soaking more than a pad in 1 hour. So if you've put a pad 1 hour later or in under 1 hour, you're already changing another pad and another pad. That is not good. Get help. If you're getting a lot of dizziness, you're getting a lot of headaches, you're feeling your heart is beating too fast, you can even hear it. You're feeling too weak, you can't even hold your baby or stand up. You can't even do any activity. It may mean that you're bleeding too much. Get help. If your bleeding is coming out in big lumps, what we call blood clots, please, again, that sometimes may be a sign that you're bleeding heavily. Get help. Sometimes the bleeding may happen immediately before you leave the hospital or within 24 hours, and sometimes it may happen after you have gone home. A few days later, you start bleeding. Be very careful. So one of the things that we say when you go home, please watch out for excessive bleeding after childbirth, and those are some of the signs that you may look out for that may tell you maybe things are not okay. I need to go to be seen to just check and see if things are okay or not. So bleeding is a big deal. The other one is infection. So infection can sometimes happen in your uterus. Sometimes it can happen in your boobs. Sometimes infection can happen in the vaginal area, what you call the perineum, where you had a cut or where you had a tear. So if you have infection, or sometimes it could be an infection that is totally unrelated to pregnancy and childbirth itself. So if you have an infection, please get help as soon as possible. Infection is a very common problem as well. One of the things that may tell you have an infection is feeling very chilly or feeling very hot, or a fluctuation of chills and hotness, feeling like you're throwing up, nauseated or throwing up in itself, a lot of pain on your tummy, a lot of pain at the perineum. Maybe you can't even sit. You have to sit at an angle, or you have to stand all the time because of excessive pain, especially if it was going down and then all of a sudden it is too much. Please get help. Infection is also one of the reasons why you may have excessive bleeding after birth, and it's important that you seek help for that. Another danger sign is signs of high blood pressure. So high blood pressure doesn't just happen during pregnancy, it can also happen after childbirth. And one of the ways to know that you have high blood pressure is severe headaches. So getting a lot of headaches that don't go away with the usual painkillers, or your vision gets very blurred, or you see bits and pieces, or getting a lot of heartburn, so a lot of pain around here, burning pain, what we call hyperacidity or heartburn. That can also be a pointer that you're getting high blood pressure. Or sometimes it's swelling up your face, your hands, your legs swelling too much. It may also be a sign of high blood pressure. If this is happening, please go to the hospital. High blood pressure is one of the big killers in mothers. So please get help if these are some of the things that you are feeling or you're seeing. Another red flag is sudden difficulty in breathing or shortness of breath. So childbirth and pregnancy, they increase your chances of getting a clot in your legs or in your lungs. And one of the symptoms of a clot in your lung, which is a killer disease, is a sudden shortness of breath or a sudden chest pain. So if you are okay and then all of a sudden you just can't breathe, or you're feeling short of breath, please get help as soon as possible, because pulmonary embolism kills, guys. It does kill. So one of the risks that may make you very prone to getting a clot is if you have had surgery, maybe your delivery was a cesarean section, if your weight is a bit too much, or if you have just been in bed the whole time. So if you are not very active, it may put you at risk of getting a clot, or if you have a history of getting a clot in the past or in your family, it can be a very high risk that you may get a clot again. So that is another risk factor. I mean, red flag to watch out for. Okay, so watch out for these things in case they happen. Please get to help as soon as possible. The other red flag that we always talk about is the postpartum depression. So if you are crying all the time, if you can't bond with your baby, if you feel like you can even harm yourself or harm your baby, you feel like a worthless mother, you cannot take care of your baby, it may be signs of postpartum depression. Please get help. Postpartum depression has cost us lives of both moms and babies. So get as much help as possible. Remember to watch out for these things. And postpartum period, guys, it extends all the way up to around 6 to 8 weeks. So it is not over until it is over. Watch out for all these signs. Whenever they arise at whatever time, whether it's day or night, whether it's raining or shining, run to the hospital as soon as possible. It's better to be told that you are okay instead of assuming that you're okay and then you actually lose your life. So these are danger signs because they are actually been known to cost lives. So watch out for them.